recently attended a seminar and it was on claim submission blunders, as I'll call them. And the lecturer was talking about how for scaling and root planing in specific, you should be submitting a narrative, and that narrative should consist of active disease tissue, connective tissue loss, apical migration, all the things that I used to practice. Now I have Charles Blair's Coding with Confidence book here, and it's from 2014. So over 10 years old at this point. And it's consistent with what the lecturer was talking about and consistent with how I used to practice. If I had a denial or an adverse determination on a scaling and root planing, I would submit a narrative or an appeal with a narrative, and I would indicate there was active disease process and that's what was treated. However, now after knowing what I know, being in the industry, reviewing for over 20 different clients manually, and then also co-creating artificial intelligence, I can tell you for the D4341 and D4342 code, that narrative is not going to be impactful. Really, the insurance companies are looking for that radiographic bone loss, whether they have an algorithm that's detecting it with their machine learning models, it has to be on the radiograph. Charles Blair's book also indicates not every insurance carrier is requiring radiographic submissions. I don't know that that's the case. I think that if you were to submit a scaling and root planing with a periodontal chart and a narrative alone, you're going to get some type of documentation requesting more information in the form of radiographs. Not necessarily a full series, but something to show that there is bone loss at the teeth that you would like considered. Now, for a narrative for periodontal treatments, for the D4346 code, a narrative is helpful if your periodontal charting does not indicate where the bleeding is. There could be 4-millimeter pockets, but for that 4346 code, there needs to be generalized moderate to severe inflammation evident. So yes, there could be 4-millimeter pockets, but if there's no bleeding, there may not be active disease process happening. So for the 4346 code, I do recommend submitting a narrative that does say that there was generalized bleeding if there was. And I do find narrative particularly impactful for the D4910, the periodontal maintenance code, because let's say you have a patient that's new to this specific insurance. With how often patients change insurance carriers, you may have a patient that has had a scaling root planing with you or with someone else, and now they're on a periodontal maintenance, but it's the first time you're submitting that periodontal maintenance claim to this specific insurance. That insurance carrier is going to need to know when the patient had scaling and root planing and if they had scaling and root planing therapy. So this would be in the month and year format. You don't need to have the exact date. You don't need to be following up with a former office to find out when the patient had that treatment. Just to the best of your knowledge to indicate this patient has had periodontal therapy and now their condition is being maintained. A narrative is also helpful for the periodontal codes if you are a periodontist and you are submitting for a periodontal surgery. Some insurance carriers do want to see some type of pre-surgical workup, which would be your non-surgical periodontal therapy, your scaling and root planings. Now, for scaling and root planing in specific, D4341 and D4342, that narrative is not going to be very impactful on your appeal. Feel free to indicate there was active disease tissue, but I know from those peer-to-peer calls, if a provider was telling me there were 4-millimeter pockets and bleeding on probing, calculus everywhere, those are not the qualifying attributes that are going to make a benefit recommendation turn into a benefit determination, a positive one. It's that radiographic bone loss.